My name is Stephanie Hughes, and if you're here, you have IC and you're having a flare-up. What do you do with an IC flare-up? Or shall we back up a little bit for what is IC? I will have a more elaborate video on what IC is. For your information, no, I'm not a doctor. I am a person who has lived with IC now for 6 years. I am a very big activist and advocate. Are they the same thing or are they different? I'm an advocate for Vulvodynia, IC, IBS, lupus, depression, all the conditions that I have. I'm very big on speaking out about them and educating others and empowering women with information. My doctors, my specialists, and all of these, the students who work with my doctors, they say that I am the biggest source of information they've ever had on this condition, which is a little sad. Unfortunately, IC is underdiagnosed. So is its co-condition Vulvodynia, which I have both. They're way underdiagnosed. The average amount of time it takes a woman to get diagnosed is 6 years. Thankfully, I'm a very persistent, very annoying person, and I got diagnosed within a year and a half. It wasn't easy. I will have a video on that and the process and the trials and where I ended up that helped me and what I'm doing now to maintain my pain. But for this video, if you're having an IC flare-up, then you are here and you're in the right place. I'm going to take you through, you can't see, I have items all over here of what helps me when I'm having an IC flare-up. And of course, why not film the video when I'm actually having one? My IC is very much controlled by my diet. My cat's going to jump up here in a second, so the camera's going to rock. Don't do it. Come here, Sebastian. He jumped up on it. It's why can you stop? The camera's shaking. Sebastian. They only do this when I try to record a video. Anyways, what was I saying? I have stuff here to go over on what could help you during your IC flare-up. I know my IC flare-up isn't food related because I'm very strict on my diet, but I did go out to eat the other night and it actually really could have been that. Do you have to, I know, I'm using a cat tree to prop up my iPad and he thinks that's a, yeah, you're gonna jump down now. Okay, we're done. Maybe I'll just cut out that whole part or include it. I don't know, my cats are staring at me like I'm crazy. So anyways, I have all these items here. I have all these items here that I want to go over and talk with you about. So let's get started. First things first, you're having an IC flare-up. What's the first thing I do? I drink water. Only you can, along with water, which is really good. It reminds me of the Adam Sandler, Gatorade, no, H2O, water sucks, it really, really sucks, H2O. H2O, please. And or you can do aloe water. Aloe water is really good anti-inflammatory for the bladder when it is swollen, inflamed, going through a flare-up. You need to get your urine as least acidic as possible. Aloe water helps. They have one at Costco, which has the little jellies in it, which I love. I think that's the best with the jellies in it. I don't like Costco's because it has less sugar in it. So I usually get mine at Kroger's, and I think it's called like Aloe Glow Water, and it doesn't have the jellies in it, but it still works really well, and it's very low on sugar. So water and aloe should be the only thing you're drinking. When you are going through an IC flare-up, cut out everything in your diet that could be iffy. You can Google IC diet, safe foods, and there'll be a list per each category of safe fruits, safe vegetables, safe condiments. You got to be very careful with condiments. There's not many that won't trigger your IC, and I do that just for as long as I'm having a flare-up. After that, I'm pretty good on knowing what causes my IC flare-up. So water and aloe water is all you're drinking. You're very strict on your diet right now. Be very, very careful of those foods that are those foods that are high irritants of your bladder, which would be tomatoes, strawberries, spinach, anything with citric in it, anything carbonated. Stay away from all carbonated drinks, no alcohol. It's not fun. I know. I've done it for 6 years, but it works. And when you're in this much bad pain, it's very important, especially if you have a lot of blood in your urine. It's microscopic where I can't see it, but when I get a bladder installation, which is one of my treatments for the condition that I do for myself, I do them once a week, sometimes more than once a week. I can do a different video on bladder installations and the benefits of that and how that's really helped me be almost pain-free with IC. But they test your urine before they give you the installation. And yesterday I had the most blood I've ever had in my urine. I think the amounts go in trace, small, moderate, and large. And I had moderate to large amounts of blood in my urine. Even on the worst pain I've ever been on a scale of like 0 to 10, I've been like a 12, I didn't have any blood in my urine. So I was only at like a 2 in pain. But then when I found out about the blood, that's when I got really concerned. I told, my OBGYN, I've never had that much amount of blood in my urine for the 6 years I've had IC. So they sent my urine for cultures. The problem is nothing else, it popped up where it would be like an infection. So we're just running extra cultures. I'm not starting on antibiotics yet because antibiotics can actually make your IC worse. If you have to take them, you have to take them, but it can also create a flare-up. So only take antibiotics when absolutely necessary. And also listen to your doctor. So we got the water, we got the food out of the way. So I think the next thing for me to go to after eliminating my food and only drinking water or aloe water is this. This is a very large heating pad. I got it from Walgreens. It's big. This is where it gets tricky. With IC, all of your nerve endings for your bladder are actually in your lower back. So, heating pad, I would start on the lowest setting. You don't want to, do too much heat. I would start on the lowest setting, and you just put this on your lower back. I know, your bladder hurts. Why am I just put it on your lower back? Just trust me, put this on your lower back. While you are laying on the ground, you can be on a yoga mat like I am right now. You can have this on your lower back. But what I want on top of your bladder is a weighted sand heating pad. Go ahead and spritz it with water once or twice. You want a warm, moist heat for your vulvodynia pain. So you're going to put this in your microwave. My microwave is cancer causing. It's a very strong. So a minute 25 on my microwave, maybe 2 to 3 minutes on like a less powerful microwave with a couple spritz of water. Then what you want to do is wiggle all the sand into the bottom, and I kind of fold it long ways, and I put that directly on top of my bladder. The weight and the warm, moist heat really make a huge difference. While you're doing that, I didn't bring it. I have a weighted blanket that I fold lengthways too, and I also put that on top of my hips to help push and bring all my muscles down to help really release my pelvic floors. If you're curious more into pelvic floor physical therapy, talk to your doctor. You can also visit Fem Fusion Fitness here on YouTube. I'll put the link somewhere. She's amazing. She's helped me a lot whenever it comes to my IC flare-ups. Meditation, yoga, and doing her pelvic floor release. It's like the opposite of a Kegel. If you have IC, don't do a Kegel. Just don't do a Kegel. You're doing the opposite of the Kegel, where your pelvic floors are like this. They're so tight. All the muscles are wrapped around it. The muscles on the inside and the outsides of your legs, the muscles on your lower back are all contributing to your very tight pelvic floor. And it takes a lot of practice and steady meditation and yoga to help release your pelvic floor. So I would definitely have extra weight. If you do yoga, they have those weighted ones that you put on your hips. That works too. Anything with steady weight to help bring your pelvic floor down. Now, what do you do with your legs when you're laying on your back? You can do one of two things. You can have yoga blocks, and I will put my feet together, and I'll let my knees fall apart, and I'll kind of angle these under my knees. You have to play with it a little bit, but it helps take all of the extra weight and tension off your bladder once you get your weight supported under your knees. Now, if you don't have yoga blocks, you can use pillows. You can like a good firm pillow. It really does make a difference. Just putting your feet together, knees apart, you need support under your knees to fully relax all those muscles. You can also go to Five Below. This is a $5 foam roller. You can put this under your knees as well. And so you just lay flat in yoga. It's called the corpse pose. And then this is just propped up under your knees. Same reason as the yoga blocks for your knees. It just takes all your extra weight off so you can really concentrate on releasing your pelvic floors. So far we have water, aloe water, strict food diet. We have a heating pad on your back, a weighted heating bag on your bladder, along with extra weights to help push your muscles down. We've got yoga blocks under your knees, or a foam roller, or a rolled up blanket, or a rolled up yoga mat under your knees. Now we can go into medication. There are different medications that you can take for having an IC flare-up. I have not taken any of the prescription medications. I have in prescription bottles, but this is just over-the-counter Pyridium. Pyridium is that medication if you've ever had a bladder infection. It's a red dye that starts in your bladder, and it goes through your kidneys all the way down your entire urinary tract. It coats your bladder and numbs it. Your urine will be neon orange. Careful, it does stain. So Pyridium, that's what I do. But if you get bladder installations, or you're getting a test where your urine has to be tested, you can't take Pyridium. You have to have it out of your system, I'd say about 10 hours. So I didn't take any last night, even though I was having a bad flare-up because I was getting another installation in the morning. Now it's in the afternoon and I just ate, so I can take it. Always take it after eating. So you got Pyridium, and then you can take Tylenol, ibuprofen. I have just prescription ibuprofen. It's 800 milligrams. It's just stronger, so I don't have to take as many. Also, you can do naproxen, which is an anti-inflammatory. That's a prescription. You don't have to do these prescriptions. You can just do Tylenol, ibuprofen, any non-steroid anti-inflammatory medication works too. Along with that, I love, love, love essential oils. I know what you're thinking. Where am I putting the essential oils? So we've got past tense and peppermint, my two absolute favorite. Peppermint I really like for headaches. Past tense, this is also by doTERRA, by the way, not Young Living or whatever it's called. This is doTERRA Past Tense Blend for tension release. I will put this on my lower back. I will put this on the insides of my legs, not in the vulva region. It is external only, but I put it in like the inside of your legs where it like meets your hip joints. I'll put it on the inside and outside of my legs as well. I'll burn for a couple seconds, but then it really, really helps with the pain. Trust me, I've even rolled this on top of my bladder. Again, it's not for internal. I'm not putting it inside anywhere in my body. I roll it on top of my bladder. The peppermint too, peppermint has a really nice cooling effect, and that really helps because for my icy flare-ups, my bladder gets very large, puffy, and swollen, kind of like a pufferfish. That doesn't happen to everyone. Everyone reacts differently when having an icy flare-up, but peppermint and past tense have to have them. And it looks like that's it. With having an icy flare-up, remember, it takes time. Doing the Fem Fusion Fitness yoga and meditation and pelvic floor release are very helpful. I know it can be frustrating trying to meditate when you're in so much pain, but I promise you, sometimes the meditation and the pelvic floor releases actually work quicker than medication and just time. You really need to be dedicated. They're only 10 minutes long, so it's completely doable. I've done them in the morning before I got ready. I've done them during my lunch break. You really need anything that helps you relax and release your muscles. Something else that I have done, only because I've had pelvic floor physical therapy twice now, is the therapist actually trained my husband on how to maintain physical therapy, because I'm not doing the sessions, because I just do them when my bladder and my IC are so flared up for months and months, maybe even a year. So I really go into the pelvic floor physical therapy only when I need it. So what it is It's like a kneading technique where, I wish I could show you on something. You are like rolling and pushing out your muscle. So how that works is you have your muscle and you have your skin that sits on top of your muscle, and between, under your skin, on top of your muscle, it's called fascia. Think of your muscle as the mattress. The fascia is the fitted sheet, and then the top sheet is your skin. The fascia, like a fitted sheet, if you were to twist it, it would cause these ripple effects along the entire fabric. This is the same thing when it comes to your bladder and your muscles and your IC pain. Your pain can start with your muscles and your pelvic floors being tight, but then it has a ripple effect, and all your muscles that wrap in and out of your legs and around your lower back are all connected. So when it comes to pelvic floor physical therapy, a lot of it is actually massaging and rolling out your insides and the outside of your legs, including your lower back. The only internal part is for your pelvic floors, where my husband will, sorry, this is going to be TMI, will insert 2 fingers straight in, and what he will feel, there's this band, and he'll feel the band will be really, really, really tight, and he'll apply pressure, waiting for it to release. There are other things that he does too, but that was all per our pelvic floor physical therapist. She's a specialist. I'm not in that. I would definitely get information from your doctor or your IC specialist. If you do live in Michigan, please, please, please contact the University of Michigan Hospital in Ann Arbor. There is a IC specialist. Her name is Gail Francis Adams. She's amazing. She started my entire treatment of bladder installations, which now maintain and control my IC pain, which I now get the bladder installations done at my OBGYN. So you really have to do your research. If you live in Michigan, I just did all the research for you. Go to U of M, meet with your specialist. There's also a Vulvodynia specialist there. And then once they figure out your treatment plan, Women's Excellence, there's a lot of different locations of them in Michigan. They do the bladder installations too. They have a bladder pain office. They're amazing. They meet every need of a woman in every age. They, of course, they have your midwives, but then they have like a bladder pain facility. They have one for menopause. They have one for, there's so many. I can't even think of anything and everything related to that area. They cover it at any age as a woman. I would contact them. They're fabulous. So I think that is it. I'm trying to think. I don't think there's anything else that I'm doing that I haven't mentioned. Those are my go-to #1 resources. I actually met with a different lady to do my bladder installation today. She was a nurse practitioner, and she was just seeking as much information as she could get about the condition, and that's my whole journey, is to educate. So I educate the women who work there that are either nurse practitioners or they get a lot of students, and my doctor is always like, okay, Stephanie, you tell them about your condition, and they've thanked me. Years later, they'll tell me that that was so helpful, and they learned so much from me about that condition. And what I'm finding out is it's really sad that as a doctor, they're not really talking about Vulvodynia or IC. And if you work in women's health, it's maybe mentioned a little bit, but that's it. So my job is just to educate anyone and everyone, including medical professionals in their career, about this condition. And so I talked with her about all of my tips and tricks, which I just shared with you, with her. Everything that I told her, I included in this video. So hopefully people will find this video and I can help you get in less pain, but you really have to be proactive. You have to find a doctor. You have to seek treatment. They'll go over, there's so many different treatment options. There's medications you can take. There's bladder installations. I do a little bit of both, along with pelvic floor physical therapy when needed, which in 6 years I've only needed it twice. My first time was 12 weeks, and my second time was only 6 because I was pretty much on top of everything. Just be very active, know your body, and don't fight. Don't stop fighting. If they tell you that nothing's wrong with you, but you know your body, it took me 1.5 years to get diagnosed. It took me 10 doctors, telling me that I was crazy. But here we are. I found out what I had. I got verification when I went to U of M. There's even a test they do for IC. It's a potassium test. It's not fun, but it's the only test that they can do. And even if you don't respond, it doesn't mean that you don't have IC. Just be proactive, know your body, never stop till you find the truth, and then just educate yourself. All right, I hope this video helped. If you're having an IC flare-up, I feel your pain. I'm having one right now. Stick to this video and the things that I recommend, and you should be feeling better soon. Until next time, see you later.